Good morning, everyone. We are beginning the last day of the NLN Virtual Summit. I hope you've enjoyed it as much as I think most of us have. And I can think of nothing more fitting today than presenting to you the Tri-Council executives from these 5 prominent nursing organizations. Dr. Deborah Troutman, American Association of Colleges of Nursing. Dr. Debbie Hatmaker, American Nurses Association. Dr. Robin Bagley, American Organization for Nursing Leadership. Dr. David Benton, National Council of State Boards of Nursing. And Dr. Beverly Malone, National League for Nursing. This may be an historic moment. For the first time this century, the executive leaders of these 5 organizations have been assembled at one of the association meetings. Their bios are available to you on the NLN Summit website. I am Dr. Pat Yoder-Wise, now known as the chair of the Board of Governors of the National League for Nursing, and I have the privilege of moderating this event. Before you begin with our august panel, let me share a brief historical description of the origin of the Tri-Council and its evolution over time. Initially, there were 3 members, AACN, ANA, and NLN. These 3 were committed to being heard by Congress and advocating for policies that would move nursing into a major player position in terms of healthcare reform, research, and funding. There was just one problem. The word in Congress was that every nursing organization had a different message, providing a wide space for the men who dominated the congressional halls at the time to ignore nursing's concern, especially considering that nurses were primarily women. Wisely, beginning in 1973, the leadership of these 3 organizations decided, with several failed attempts, to join forces as an alliance, an inter-organizational system, yet without an internal framework for record keeping. They met regularly to share common concerns and needs, with the goal of perhaps one day resulting in one voice. As issues of nursing shortage and clinical nursing staff arose, the need became clear in 1985 for the inclusion of the American Organization of Nurse Executives, now named the American Organization for Nursing Leadership. One governance boundary on decision-making allowed the group to stay united even through challenging differences. That boundary was that all decisions had to be unanimous in order to be labeled as a Tri-Council decision. In 2019, the National Council of State Boards of Nursing, by invitation, joined the Tri-Council. The Tri-Council's name was already being challenged from its root of the original 3 members, so a critical moment of transformation allowed the organization to redefine what the term Tri-Council meant. And that is focusing on 3 areas: practice, education, and regulation. With that introduction, the panel will begin in the following order. Deb Troutman will speak first from AACN, followed by Debbie Hatmaker from ANA, Robin Bagley from AONL, David Benton from NCSBN, and then Beth Malone from NLN. Colleagues, we are so pleased that you are with us today.
Thanks, Pat. My unmute was a little bit slow. So thank you, Pat, and thank you, NLN, on behalf of all of my colleagues for the opportunity to join you today. I want to begin with a short story before I begin my remarks, and that is that we all recognize we face some unprecedented challenges with the pandemic, but we also, as you said, Pat, these are historic times, especially that we're coming together today. This is a wonderful panel, and we have much to celebrate. The story is that I started at AACN in 2014. One of the first nurse execs that I met was Dr. Beverly Malone. I remember being in the taxi going to the restaurant. Bev knows, but so do some of the others, that I have a very close relationship with my mom. And I was telling her that I was going to meet this extraordinary leader. Well, I want to say I knew then, and I am so glad the Academy has recognized now the living legend we have in Dr. Beverly Malone. So on behalf of all of my colleagues, we say congratulations. And she's humble, we know that as well. But really, Bev, your leadership is phenomenal, and we greatly appreciate it. I appreciate the leadership of all of my colleagues. We had a strong relationship before the pandemic, but it has continued to strengthen as we all think about the issues that are of importance to the profession and where we have some intersection, of course, but even in those where they're distinctly unique to one or the other of us, because of our strong relationships, we are able to reach out. It's my understanding, I believe it was as early as the 1970s when the execs came together and decided to form the Tri-Council. And I'm to speak today about the importance of a unified voice. As we know, we all have different missions, and we don't always have alignment with some of the particular issues that are under and encompassed by our missions. So as Pat mentioned, the Tri-Council moves forward when there's unanimity of voice. However, the Tri-Council does have conversations and recognizes that consensus building is important within and even beyond our work. But my story, other story, is that I had the privilege, and there's a picture, if you could see virtual, but behind me where my finger's pointing, I had the privilege of working for then and now the Speaker of the House. And this was actually my first opportunity to get to have a deeper understanding of how the associations work together, or in some instances did not work together. I will share that was back in 2007. Where I started in my fellowship and was there for 3 years. At one point, multiple groups, not just nursing, health professions, it was during the time of shaping the Affordable Care Act, were coming to the Hill to advocate on behalf of certain policies. And I was working with a very bright, very young, only 20 some, he told me not to give his exact age, but he was 22. He was brilliant, but this aide that was working for the speaker, and he invited me to join him to go and meet with some nurses that were coming. And he said, I want you to watch what happens, because they're going to ask us about something in particular. And he said, and then I just want you to observe what happens. So this young man, as a group of nursing leaders, it was not the Tri-Council, as a group, not a group, a few of the nursing community came to meet with him. And again, not today's nursing community. And they were talking in a common voice. And then he raised a question about education preparation. And then there was some pretty significant disagreement in the group, and the group was comfortable sharing it with this young man. Well, what they didn't realize, I think at the time, was, so then he had the meeting, we left, we went back, and he said, you know, they don't understand. He said, we can't solve the disagreement for them. So when people come to the Hill, or anywhere probably, but he said certainly when they come to our office, if they have differing opinions, we wait until they can resolve it. We're not going to resolve it for them. So yeah, I thought that was really exciting. And then fast forward, that was at the beginning of my fellowship experience. Then a group of policy leaders came. They were actually the policy leaders of all of these associations that are here today. Not the National Council, because the National Council would not come to the Hill at the time, but they came and they presented a document to the Speaker's office and to the committees of jurisdiction. And that document was the nursing community at the time. And it wasn't as big as it is now, 63 members, but it was, my understanding, it was initiated by Tri-Council and the Robert Wood Johnson Health Policy Fellows to come together and put together the nursing perspective on important policy issues for healthcare reform. And not just what we needed for nursing, but what we needed for the country. And I will share with you all, while we know that our evidence and our documents don't always inform, this one did. Many times people would call me as the fellow in the speaker's office and say, you know, in that document, what did the nursing people think about this? And so I just share with all of us that we have continued, I know, to mature in our recognition of the importance of a unified voice, also respecting our differences. There are times where we aren't going to be able to agree, but we are, for example, Title VIII, Tri-Council has had a long-standing history of having a common voice around Title VIII. And then I will share that, as you're aware, if you go to the website, so I won't go over all of them, but we most recently came out with a statement about voting. And also some of our concerns were expressed about withdrawal from the WHO. So in concluding my remarks, I would say many of us were aware a while ago, they've taken it off of their header, but the Robert Wood Johnson Foundation used to have a quote that, as I understand, was an African proverb, the source unknown. And the quote was, if you want to go fast, go alone. If you want to go far, go together. I am privileged to say that I have had the opportunity to participate with these great colleagues in going far together. Thank you.
Thank you.
Right. Well, I'm Debbie Hatmaker. I'm very pleased to be here this morning representing the American Nurses Association, and I'm sure all of you know that ANA represents the broad interest of all 4.2 million nurses in our country. But we work in coalition, as you heard Pat say. We were one of the founding members of the Tri-Council and have long been dedicated to coalition work. And find that's the best way to get the work done, even though it can be challenging at times. I think you heard from Deb's stories, the challenges of working in coalition. But as ANA works on a number of foundational and critical issues that cross nurses, we certainly recognize, as we do foundational scope and standards work, specialty scope and standards, the Code of Ethics for nurses, health and wellness for nurses, and certainly advocating, as we do regularly on a number of healthcare issues, the best way to get the work done is through strong coalitions, and whether that's informal or formal. And we do that in a variety of ways with our 50 constituent and state nurses associations, our 39 organizational affiliates, certainly the example you have here today in front of you with the Tri-Council organizations, and also coalition building that we do on specific issues. As we point to our work in coalition during the pandemic, I can say to you, we would not have been as successful on a number of our tools, resources, and advocacy if we had not done it in coalition. And I'll just give you a few examples of that. While we have done a very successful series that has received some very positive feedback, a webinar series, 7 educational webinars that we've done very quickly to turn around for practicing nurses, we haven't done it on our own. For example, when we knew that nurses were getting pulled into ICUs, nurses from medical surgical units, we reached out to our colleagues in critical care and said, help us work on this and turn this around quickly for our nurses, and to be able to do that. And that's been very highly successful, as we've seen over 300,000 registrations for that series. But as we develop those COVID resources, we know that we have to work in collaboration. I'll give you another example where the Tri-Council in particular came into importance as leaders from the Assistant Secretary for Preparedness, one of our federal agencies, reached out to ANA. They began, this was early in the pandemic. As you know, the long-term care facilities were hit in particular very hard, especially early in the pandemic. And they were looking for ideas and ways to think about how could they perhaps mobilize nursing students to help support, whether it was in helping with education for care providers in long-term care or other solutions. We knew that we weren't necessarily the best ones to answer those questions. And so I reached out to my colleagues at the Tri-Council because I certainly knew this involved education and regulation, very much so. And so we certainly pulled them into those discussions with the federal agencies. And that often happens when federal agencies, if they're not sure who to call, sometimes they call an individual organization, sometimes that's ANA, but we're very quick to pull in and collaborate with our colleagues in order to get the work done. A number of other things that I'll mention as far as strengthening our collaborative work. Our foundation has been able to raise $11 million to support the coronavirus work that's happening, direct care for nurses. We've now given over $2 million directly to nurses who've been impacted financially. Also to develop educational resources, to really look at surveying nurses on a regular basis to see, are there financial needs, are there mental health needs, are there certainly the ongoing issues around PPE, and to develop a number of mental health resources that we are pushing very hard to have uptake during this stressful time, because we are certainly hearing from nurses who are under a great deal of stress, and we're seeing a number of physical and mental impact for that, and likely will see for quite some time. So we're very pleased that the foundation has been able to engage in that fundraising and collaborate with a number of organizations, because we are not holding on to this just for members. It is available for all nurses, and as we collaborate, you'll hear a little bit more about a collaborative opportunity with that fundraising related to a summit that we're planning. And so we'll talk a little bit more about that as the Tri-Council is coming together again to focus on what are we learning related to COVID-19. So I'll turn it over to the next speaker.
Robin, you're muted.
Thank you. Sorry about that. Take two. I'm Robin Robgley. I am the CEO of the American Organization for Nursing Leadership, and I also serve as Chief Nursing Officer for the American Hospital Association. I'm delighted to be here today. I think it's long overdue that all of us, get a chance to share with different nursing constituencies, basically, what we've been doing as the Tri-Council and our message. So first I have to start with a real brief story. 2 years ago, actually my anniversary of working at AONL was yesterday, 2 years. And I think back, I had been in nursing leadership for the rest of my career pretty much, except for a few years early on when I was, practicing clinically at the bedside. And after 35 years in one organization, 20 as Chief Nursing Officer, this was a big move for me. Not only did I leave my family in New Jersey to come and work in Chicago basically during the week and have side trips to Washington, D.C. and traveling across the country, it was a whole new set of colleagues. I mean, it was a big transition for me. So about a week and a half in, the beginning of October, I had my first Tri-Council meeting in Washington, D.C. By chance, I had also lost my voice. I guess I was stressed or I had a cold, and this was 2 years ago. So I was attending, our meeting, our in-person meeting in Washington, which is always kicked off with a dinner, pre-COVID anyway. We kicked it off with a dinner to get to know our colleagues. I was anxious. I felt really, bad that I didn't have a voice, and I immediately felt welcomed. And I remember going home after the dinner or going back to the hotel and thinking, this is really a group of colleagues, but somebody who, a group that I really believe will help me in my new role. So I just want to say thank you to all of you, because you have been an extremely welcoming group. And not only are you colleagues, I consider you all friends. So a little bit about AONL, just my commercial is that, you may have known us as AONE, which is the American Organization for Nurse Executives. We changed that in 2019 because we felt that it really didn't speak to what our organization does. We really are, we provide educational and leadership development opportunities for nursing leaders at all levels. Some of our signature work is our nursing leader competencies, and we really do believe that our former name wasn't as inclusive as it needed to be. We are 11,000 members strong, and this year has challenged all of us for sure. I really believe that Tri-Council has given us the necessary venue to speak with a unified voice, as Deb mentioned earlier. And this is as a result of frequent and scheduled meetings and communication. I think that really helps because it's not just in crisis that we reach out, but we really have been able to establish a great working relationship. And as Deb mentioned, we don't always agree, or nor can we, but I think that, there are certain issues that we certainly are very aligned with, with our opinions and our stance. So a little bit about the pandemic as we look through, everyone looking through the lens of COVID right now, it's challenged all of us in education, practice, and regulation. When we think about past emergencies, I think about, episodic things, and usually not involving the entire country, in fact, the entire world. So when we think hurricane or flood or wildfire, we think regional in most cases. And we also think, as I mentioned, really episodic. It's going to be really difficult for a short period of time, but we're going to mobilize help. We're going to all come together, but then we can kind of go back to our, our little, comfort areas or areas of competency. This has really changed, at least for my lifetime. I have never experienced anything like this, of this magnitude. When I think back to early March, it seems like in many ways like it was 3 years ago, and that we had really no idea of the duration of this pandemic. We've used the word unprecedented, and I really do believe that, that's what it is. So the Tri-Council has really given us the strong foundation, and key to that are relationships. So, leadership and relationships, I think, really go hand in hand. As conduits, we facilitate the issues and the connections easily and quickly. And I'd like to give you a couple examples, and a few might have already been touched on, but for example, I was at a meeting of practice leaders, and the practice leaders in the region, it was actually one of the regional meetings that we have with nurse executives around the country. The issue was raised about NCLEX testing issues and the difficulty it was for new graduates in one particular state to timely register for the testing and, become registered nurses and then become part of our nursing workforce. So immediately, after the meeting, I think I called you, David, but I might have sent you an email too. And I said, I know my colleague, David Benton from the National Council of State Boards of Nursing knows the people to connect with in that state to make sure that these issues are addressed. And that was, he was able to intervene, and I actually got feedback that it was very helpful. Many concerns, from a education perspective, around clinical placements for students have been voiced. And if I could see all your faces, I probably would see a lot of nodding heads. But together, we have worked to advocate for local and regional nursing leaders and those in academia to really work together to ensure that students aren't an afterthought in the plans. Every organization now has their pandemic plan. Initially, it was very short term. Now I know all of our healthcare organizations are really looking into middle to end of next year, and we can't have an interruption in education. We need that pipeline of nursing students. From a practice perspective, we certainly see that, but I think sometimes it was easier to say, okay, well, let's hold off on student we'll think about them later. Well, they're really key. We need to make sure that we are working locally. And that's an issue that, of course, my colleagues, Beverly and Deb, you know, again, the conversations happen very readily and easily. We pick up the phone, we participate in some of those conversations together with some of the regions, deans and nursing practice leaders. And I think that that's gone a very long way to make things more smooth. And we were, early on in the pandemic, the National Council of State Boards of Nursing reached out to us. I believe all of us on the Tri-Council had a seat, but on a task force that was convened immediately when we were concerned that we were going to have enough nurses in the workforce, and there was talk of easing licensure restrictions. So, David's team convened a large task force where we all were able to weigh in on, some of what we believe would be accommodations made to bring nurses back into practice, but also very carefully consider the safety ramifications and make sure we didn't go way too broad with that, because as the National Council, the safety of our citizenry is really important. So we had that really great blend of dialogue in that example. And again, it was just, an email or picking up the phone, and we mobilized the troops. We mentioned a little bit earlier, I believe it was Debbie who mentioned the Get Out the Vote initiative. Beverly basically brought that to the Tri-Council, and we all came to consensus about the statement, which we thought was, really important for us to do. And we're going to talk a little bit about the Tri-Council grant, which we're really excited about. So I guess in conclusion, I'm very convinced that strong relationships among our organizations and our leaders lead to effective collective outcomes. It really is an honor for me to represent AONL as a member of the Tri-Council, and I really look forward to our continued collaboration. Thank you.
Thank you very much, Robin. My name is David Benton. I'm the Chief Executive Officer at the National Council of State Boards of Nursing, and it's a real pleasure to work with my colleagues and the elected leadership of the organisations as well. One of the things that I've been asked to focus in on is the impact of the Tri-Council beyond US territorial borders. The Tri-Council has a phenomenal reach in terms of both its published work, its website, but also of the individuals that participate within the Tri-Council network. And this is something that I think American nurses should be really very proud of, that historically American nurses have always been great collaborators. If you think about the foundations of the International Council of Nurses, it was really through happenstance and the connection of an American nurse with a British nurse that actually brought about the International Council of Nurses, along with peers from other parts of the world. The important thing is that as nurses, we see the bigger picture. We don't look at the disease, we actually see the individual in the family, in the environment within which they work. And therefore, the work that American Nurses has done with collaborators from around the world has really been very important in dealing some of the biggest issues that nations have faced. And I think we're there again. If you think about the founding of the International Council of Nurses, that was really brought about in relation to connections between women in relation to the suffrage movement. Around the world at the moment, the whole issues of social justice is a critical element. Also, the Sustainable Development Goals. That's not just looking at health in a narrow sense, but actually looking at health within context, the impact of climate, the impact of poverty. And these are all issues that we as nurses working with communities have a great deal of expertise to offer. So part of the discussions we have at the Tri-Council is not just about the clinical aspects or the educational aspects or the regulatory aspects, but it's about how nursing can contribute much more widely. Now, I think it was Pat in her introduction that highlighted the concept that unless all of us agree, it isn't a Tri-Council statement. And that's important because it actually gives that focus for legislators to understand. But it's also important to recognize that whilst we are all agreed on the vision, the outcome that we're trying to achieve, the levers that we have as individual organizations are different. And we can actually use those levers to our advantage. Sometimes it's important that our education colleagues lead. Sometimes it's for practice, other times it's for regulation, and other times we really need to work in a coordinated way so that there is synergy of message. It's not simply a single one size fits all, but it's certainly a journey that we are all sharing together. Perhaps we, along the way, will actually be able to benefit our membership or our stakeholders in slightly different ways, and that's absolutely fine. So I think that's part of the important. Prior to coming to the United States, I worked in Geneva as the Chief Executive Officer of the International Council of Nurses. And one of the things that my predecessor and I did when we were trying to emulate really the model that was in existence in the United States, we brought together stakeholders from government, from education, from regulation, from the professional association to try and actually work collaboratively to influence the World Health Organization and the World Health Assembly. This is a meeting of ministers from around the world every year in May. And that same concept of speaking with one voice, sending messages in a consistent way, is how we were able to move forward a number of major important issues. And that was modeled after the model of the Tri-Council in terms of making sure that we all have a voice, that we all have a message, and that we send that collectively. As we move forward, we are definitely facing a time of unprecedented change. And this is not just change at the bedside, or change in the community or in the hospital, or in education or in regulation. This is systemic change. And that will only be brought about if we are able to work collaboratively together. As we have those discussions, we all bring slightly different perspectives. And by working and understanding those perspectives, we come up with a much stronger solution that collectively has far greater influence. So in the months and years ahead, I'm looking forward very much to continuing to work with my colleagues in actually having that consistency of vision so that we can actually influence the policy agenda, not just within nursing, but that wider agenda as we move forward to actually provide services to a very changing community that have different needs that will undoubtedly challenge us in our innovation and our education and in our regulation and in our practice. But together we can do far much more than we can individually. And that is something that I have learned in working with these wonderful people and the elected leadership who always come up with bright ideas, who throw things on the table and say, how might we solve this? And how might we solve it together? Pat, I think it's over to Beverly now.
Yeah.
It is. Thank you.
Hello, everybody. I'm Beth Malone, and I have the privilege of working with these incredible colleagues. And I have to tell you that that makes it easier. I've been fortunate. At one point, I was the president of the American Nurses Association. So I was involved with Tri-Council then, and that was back in 1996. And it was a different growing organization at that time. So we have been growing all the time. And I think that's one of the amazing parts of it, is we can just see the growth of how we work together. And when this pandemic came along, we were already at a place where we could work with one another, where we could appreciate one another, where we had similar values, even if we came out with a different end, a different decision or a different principle. We knew that all of us had basically the same value system. And you know, you might say it a different way. I mean, how many different ways can you say caring? But we all care. We all have caring organizations. How many different ways can you say integrity? I know that my colleagues are full of integrity. And from this presentation today, I hope you can hear the basis of integrity in what they're saying. How do you talk about diversity and inclusion as a value? And with all of the contextual things that are going on in the system just outside our doors, it's like what my colleague Robin said, you know, it's not going to be episodic. It's going to be really, this is the way it is. So how do we address those issues? And we are looking at how the Tri-Council needs to step up to the plate around diversity and inclusion. And then and these are NLN core values. And the final one is excellence. And it's one of my favorite definitions. So I remember that one so clearly. And it's co-creating and implementing transformative strategies with daring ingenuity. And I have to say, I have to admit, I have to admire my colleagues as they have done just that. They are right at the edge of creation, but it's collaborative, right at making things different and doing it with daring ingenuity. And so I am privileged to be a part of this group and to be one of the number. There's some religious old song that says, I just want to be one of the number. I mean, it's not like I need to lead. I don't need to be out. I just want to be one of the number. And I am so privileged to be one of the number within the Tri-Council. So I wanted to, after that testimony, I wanted to share with you about one of the things I think that works. You know, we've already given you the basis of that if we all don't agree, it's not Tri-Council. And I think that is a life-saving principle that we have. But I also believe in retractable bridges. And so when we collaborate, we extend out, we roll out our bridge. And I might roll it out to Robin or to one of my Debs or to David. And he grabs it and hooks it on. And so we have a bridge in which to walk across, in which to, and sometimes the bridges are just all of us have the same bridge and it's so powerful, but we have a way of collaborating. But colleagues, they're retractable. So just because you put that bridge out there, it doesn't mean it has to stay. It means that in that situation, for that cause, for that issue, we need to collaborate on that. And we're going to, boom, goes out the retractable bridge. But when needed and necessary, we can easily roll back the bridge and just shout across and say, I got to roll it back. You know, some things have moved in my organization and I need to roll that back in. I think collaboration is really about retractable bridges, understanding how to extend those and when necessary to pull them back in. The other thing I wanted to just mention briefly is just respect for each other. An incredible amount of respect for one another. When you work with people that you can actually respect, I think Aretha Franklin talked a little bit about it, so you might go back in your memory list and say, and do the RESPECT kind of memory bank that you have. But that's what we have here with my colleagues that I work with. True respect for one another. So even when we disagree, and it's cannot be a Tri-Council decision, the respect doesn't go away. The respect is baseline. It's not a retractable thing. The respect is permanent, in concrete or whatever is permanent, that will make it last. And that has been one of the most precious things about working with each and every one of my colleagues. The mutual respect that is there. And I would say one last piece, that if you're going to have a coalition, have some caring, make sure there's some caring in there somewhere. Make sure there's some integrity. It always helps to have some integrity. Make sure that diversity and inclusion is not an external fringe issue, but is right there in the middle of what you're doing. And make sure that excellence will not go anywhere. Thank you, Pat.
Okay. And now Robin and Debbie are going to tell us about the summit.
Okay, Deb, I'll kick it off and then you can certainly fill in the parts that I miss. Is that okay?
Mm-hmm. Yes.
Okay.
It's Deb, not Debbie, that's doing this.
Yeah, sorry. Okay. So I think we've thrown some little teasers out there about what we're planning, but it was an idea and I don't really even know whose idea it was. You know, one of our conversations, we talked about, you know, of course, COVID-19 has been a hot topic of our conversations, you know, in this past 6 months. And it was probably several months ago that we began to feel collectively that, you know, there were lessons learned from COVID, but also themes emerging. And, you know, I like to, you know, some people have said I'm Pollyanna, but I like to be, you know, the glass half full person. And, you know, silver linings to me was a phrase that kept coming up when we looked at the pandemic. You know, it has been filled with a lot of sadness, but there's also some really great stories and great things that have come out of the experiences that we've shared and heard about. So as we talked, we thought it would be a great idea to, while it's fresh in everyone's mind, to convene a group, nurses, stakeholders. You know, we're really trying to cast the net widely here and convene those folks virtually, of course, to talk about what some of those themes, issues that have been revealed by, you know, by the pandemic for nursing and impact for our, you know, for our patients, and how can we capture that and come together, again, tri-council collaboration, you know, everybody on the same page, and move some of these ideas forward. So to make a long story short, this week we've been planning in a planning process, but we received notification this week that our proposal was funded by, and thanks to Debbie and the American Nurses Foundation, some of those funds that she mentioned will be you know, granted to us to be able to make sure that we can do this with expert facilitation, you know, putting out a pre-survey so that we have, we're not starting with a blank sheet of paper on the day of our summit. We have determined that December 3rd is the day that we are going to be sponsoring this, convening this virtual summit. We're in the planning processes now. We have a mechanism planned to get a really broad base of responses to our pre-survey, if you will, and take all that feedback into consideration. And really, it's to look at, and what I think makes this convening unique is that we want to look at the intersection of education, practice, and regulation, and from that lens, really determine our next steps and how we can come out with one voice, and, you know, not, you know, hopefully we won't come out with a whole lot of things. We want a critical mass, a critical few issues or recommendations, you know, to move forward in a number of ways. So I'm going to pull up there. Deb, anything to add? I'm sure I missed a lot of our, you know, a lot of our work.
No, thank you, Robin. I think you did a great job. And as Robin mentioned, this was a collective effort from all of the Tri-Council, recognizing there are many convenings that are happening across the country and great learnings are coming from all of those. And we truly wanted to focus on this intersection so that we're not only capturing the lessons learned, but even from if we've had failures or mistakes. As Robin and all of the Tri-Council colleagues have mentioned and even shared in examples, we know that we have also implemented some changes. And some of those changes we likely all want to see as sustainable changes. We also recognize maybe now everyone wants to be invited to come to the table, and unfortunately that's not going to be possible. But what will be possible is, as Robin said, there's an intent for a wide outreach, and we intend to provide a summation of this convening that can be utilized by many of us across nursing and maybe even as a model for other health professions. So we're very excited about it. To my knowledge, an event like this has not occurred yet either in at least in my time in the profession. And I do want to, again, as Robin did, and I know all my colleagues, give a shout out to the ANF. Thank you very much for the strong support for this convening. We are very appreciative. So that's the additional comments I would add. Thank you.
Great. Well, thank you all so much. Here's what I got as takeaways, and I would encourage all of you who are engaged with this session to think about some of the key messages that this group provided. Remember that the elected officials of each of these organizations come and go. These people are the heart of the Tri-Council. So it's really important to think about what their messages are. So Deb started out with a really great point, which is we think about all the negative things that's happened in pandemic situations. But what she said was, this required increased collaboration among the Tri-Council members. Debbie Hatmaker pointed out a really critical point for all of us to remember, and that is that our colleagues, no matter where they are, and perhaps us, need mental health resources, and the ANA has done that. Robin talked about the fact that leadership is dependent on relationships and emphasized the importance of the collaboration between education and practice in order for us to be real in relation to what's going on. David pointed out the international reach that we have, and sometimes we think of ourselves as American, when in fact we really have international impact. He talked about the sustainable goals, and what he said that was really striking to me was we all come together with a common vision of something, and then we each do what is relevant for us in our respective organizations in terms of the implementation. Bev talked about, common values and the idea of co-creating. And that is what this group does. They co-create. And I love the retractable bridge, because sometimes you do reach out to a partner and then you realize that really that work is done and you need to reach out to someone else, or that you have perhaps met as far as you can go in working together. And so you need to release the bridge and move on. And her final point, respect for each other. This is a group that comes together and you know they respect. Now, just a little light side, you did notice how frequently they talked about having dinner together. Well, part of that is how they create this relationship. And we have gone to some interesting places, but the key is that is informal conversation. That's where we can really talk about, here's what's on my mind about what's happening in the profession. And to me, the final coup d'etat, or the cherry on top of the whipped cream on top of the sundae, came from Robin. And she said, well, I can't remember whose idea it was. I think that is very telling. It isn't about, oh, this group decided, or that group brought forward, or so-and-so had this idea. It is, I can't remember whose idea it is, but it is something that we choose to move forward on. Let me thank each of you for this important and revealing presentation. The Tri-Council has taken an important step in advancing nursing as a profession as an influencer in the halls of Congress. Thank you all for your leadership and thank you for being together today in this historic event. Bravo.
Thank you, Pat. Thank you.
Thank you.
Great to be here.
Hi, colleagues.
Bye.